So, again, another unhinged medication given to me. I don't really understand what these people are thinking. You should not take this medication if you're allergic to it. Well, how the hell do you know if you're allergic to it if you don't take the shit, number one? But then it's followed up with, and you shouldn't take it if you have asthma, bronchitis, or emphysema. Well, I'm thinking that COPD pretty much qualifies as one of those, since it's a combination effect of two disorders. This is complete insanity. I don't understand why you even put me on this drug if this is what I mean, out the gate it says if you have this shit. Numbness and cold or cold feeling in your hands and feet. Well, I had that before I started taking the pill, so how the fuck am I gonna know the difference? This is just crazy. I'm so pale. I mean, it's got this list of stuff here that says these are signs of allergy, but I mean, a lot of these symptoms I already have. So it's like, how would you know the difference? Feeling like you might pass out. Well, maybe that was smart on my part then to take the dumb stuff at night, the one time I've taken it so far. Because the more I read, the less likely I am going to continue taking this. Carvedilol is used in patients unable to tolerate ACE inhibitors. But it's especially recommended in combination with thiazide-type diuretics, except that it was the hydrochlorothiazide that shut down my liver and kidneys to start with, so I'm really starting to become very convinced that these people are just fucking poking around in the dark. It's interesting when you get a phone call from the doctor, but it's even more interesting when it's the pharmacist that calls you. We're just calling to check on you, see how you're doing. Really. Because the last time a pharmacist did that, quite frankly, that woman saved my life. Yep. Turns out I was allergic to a drug that had been given to me. Yep. I'm going to keep reading through this PDF for this drug, but, wow. Just based on the two other sites I've looked at already, I'm questioning why this was even given to me. Oh, and isn't this special? Side effects. Bradycardia, postural, hypotension, edema. See, so the one thing it's supposed to take care of, which is the swelling, is something that it can actually cause. Central nervous system, it can cause dizziness, somnolence, insomnia, fatigue. Oh, here's the one I really needed help with, gastrointestinal. That's all I need is diarrhea and more fucking pain. Gee, thanks. Neuromuscular and skeletal back pain. It can cause back pain. Can create rhinitis, pharyngitis, dyspepsia, other adverse reactions occurring in less than 1%. B-block, extrasystolis, hypertension, hypotension, palpitation, peripheral ischemia, syncope, ataxia, vertigo, depression, nervousness, malaise. Flatulence, constipation. Again, this is what I need with my IBS, right? This is exactly what I don't need, but I'm being a smartass at this point. Fuck, really. Drug interactions. I don't know what rimpafin is. I probably don't need it. It looks like it's some kind of a plasma concentration. What is this? Wait a minute. Rimpafin may reduce the plasma concentration of carvedilol by up to 70%. Aluminum salts, barbiturates, calcium salts, calcium. So you ordered this for me and still ordered me the vitamin D. Congestive heart failure dosages may be individualized and closely monitored by a physician during titration. God, I'll learn how to say that word one of these days. Dosing of digitalis, diuretics, and ACE inhibitors, if used, should be stabilized. Well, I'm not on any of that stuff, so wow, and just oh fucking wow, and happy, happy, joy, joy, and I just love it when people call me on a Saturday afternoon to dump shit in my lap. And then she tried, I said, listen to me, I said, with everything I take, with the 3 drugs that we have, well, 4, you can't really count the vitamin D, that's only once a week. Anyway, all of these, every one of these, will leave you like this. This is why a lot of times people say, you're drunk. No, I'm not, I'm medicated. And this is all for blood pressure, with the exception of this one. This is for the funkabootiitis. 16 years with that miserable shit. And these are the 2 blood pressure drugs. And all 3 of these drugs have this. And people complain to me, and I'm like, I can't help it. Right? May cause drowsiness and dizziness. Alcohol may intensify this effect. Are you kidding me? Why would anybody drink on this shit? Hail to the nah. This drug may impair your ability to drive or operate machinery. And when I said something to the pharmacist, I said, I said, these medications could cause me to get a DUI. Oh, no, she says, that only counts if it's a narcotic. It says driving under the influence. It does not delineate between narcotics and blood pressure stuff. So I think she's a little misinformed. But anyway, maybe I should have just gone and taken my tubby like I had planned to a couple hours ago. Nobody wants to hear that their heart's not working right. Nobody wants to hear that shit, trust me. Especially when you don't feel it. That's what's so deceptive about this high blood pressure, which I still believe was brought on by the use of all these fucking drugs to treat all this other shit that was supposedly wrong with me, that you never fucking actually treated. You just tried to turn me into a fucking drug addict. And when that didn't work, oh, bonus points, we made her sick anyway. They couldn't get a repeat customer on all that other shit, right? The painkillers, the anti-inflammatories, they couldn't get me to commit to that stuff for more than maybe 6 months, a year at a time, right? But you said I had high blood pressure 14 years ago, and you started treating me with lisinopril, which filled my lungs with fluid and led everybody to believe that I had respiratory disorders that I didn't have, and the one I did have, you missed. So I'm just... And then I'm in this conversation where people want me to buy into this crap, this junk science about a chemical imbalance, and we have a pill for you. No. No, 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 no. Been there, done that, seen all this crap before, got all the t-shirts, and guess what? All any of it ever netted me, and mine started out as an injury accident. So all my crap ever netted me was now a trash stomach. My whole, from my esophagus to my colon, trashed. Kidney, liver, heart, all of it fucking done in. Most of it done in by what? Big Pharma. And then what's really drastically sad is that in the midst of treating fibromyalgia, which they originally decided was a mental health disorder, just so you know, I was also treated with all these so-called SSRIs, psychotropic drugs. All they ever did was leave me like this. How did that ever fix? It never fixed anything. It certainly fixed this, though. Never got rid of the pain from the fibromyalgia, which I believe is a form of peripheral neuropathy, which I believe is directly related to the fact that I only have half a thyroid, and my poor stuff up here trying to fight off everything and be king of the world for everything. And the result, the netting result of it not being able to do its job properly is that it caused pain. Astoundingly, though, so many of these doctors tried to addict me to their Schedule II narcotics. That's just absolutely laughable. Because I don't like anything that has me feeling like this. That's why a lot of your crap didn't work. And basically what these folks are talking about in this movie appears to me to be a form of maybe what you're dealing with over there is post-traumatic stress disorder. And I'm sorry, baby, there's no pill for that. And you will never convince me about chemical imbalances. You won't, because that's always the door that is opened, and the next thing that is said is, here's a pill. And please don't tell me, don't delude anybody else either into thinking that that's not an open door for pharma, because it sure the fuck is. I've watched it happen for far too long. And if I wasn't enough of a crash test dummy for you, I got plenty of people around me that I can assure you will testify to this. Yeah. But then that still begs the question of how we went from spiritual to psychological, when at the end of the day, most of these psychology people think those of you with this spiritual fascination are fucking off your rocker anyway. But you'll suck up to them because you don't know any better. I know, because I'm witnessing it. I mean, out the gate it says if you have this shit, numbness and cold, or cold feeling in your hands and feet. Well, I had that before I started taking the pill, so how the fuck am I going to know the difference? This is just crazy. So, again, another unhinged medication given to me. I don't really understand what these people are thinking. You should not take this medication if you're allergic to it. Well, how the hell do you know if you're allergic to it if you don't take the shit, number one? But then it's followed up with, and you shouldn't take, the more I read, the less likely I am going to continue taking this. Carvedilol is used in patients unable to tolerate ACE inhibitors. But it's especially recommended in combination with thyroid. I'm so pale. I mean, it's got this list of stuff here that says these are signs of allergy, but I mean, a lot of these symptoms I already have. So it's like, how would you know the difference? Feeling like you might pass out. Well, maybe that was smart on my part then to take the dumb stuff at night, the one time I've taken it so far. Because take it if you have asthma, bronchitis, or emphysema. Well, I'm thinking that COPD pretty much qualifies as one of those, since it's a combination effect of two disorders. This is complete insanity. I don't understand why you even put me on this drug if this is what